If you live through a major natural disaster, your immediate focus is on survival. But researchers are now finding that the extreme physical and emotional shock can alter how your heart functions decades later. To understand how this happens, we look at a long-term medical study based on the 1976 Tangshan earthquake in China. This was a magnitude 7.8 event that leveled 90% of the city's infrastructure and claimed hundreds of thousands of lives. Medical researchers tracked thousands of survivors who had no history of cardiovascular issues. 40 years after the quake, they discovered a pattern. Those exposed to the disaster had accelerated plaque buildup in their carotid arteries, the main blood vessels in the neck. The Tangshan data provides a roadmap for prevention. We have organized these insights into a 4-point post-trauma heart health action plan designed to be shared with a physician. Identifying a history of trauma is a medical starting point. It allows you to unlock targeted, preventative care before physical symptoms progress. Step 1 is mapping your personal risk profile. Start by writing down your trauma history and your biological sex. The Tangshan study revealed that cardiovascular risk following a disaster is unequal between men and women. This chart shows the adjusted odds of developing carotid plaque for survivors. Women exposed to the earthquake had a 2.32 times higher chance of developing plaque compared to unexposed women. For the men in the study, the elevated risk was not statistically significant. If you are a woman, note your age and socioeconomic status at the time. The data shows this risk multiplies for those over 65, postmenopausal, or those with limited income or basic education during the trauma. Now that you have your profile mapped out, you can check off Step 1. Because this risk is individualized, women who meet these compounding criteria must be the strongest advocates for their own heart health in a clinical setting. Step 2 is identifying the correct diagnostic tools. A standard checkup or a blood pressure reading often misses the specific type of vascular damage caused by decades-old trauma. The exposed earthquake survivors specifically suffered from high carotid plaque burden. This means they had 2 or more distinct plaques growing inside their neck arteries, restricting blood flow over time. To find this, write down "ask for a carotid ultrasonography" for Step 2. This is the phrase required to establish your baseline vascular health. It sounds technical, but a carotid ultrasonography is a painless, non-invasive imaging test that uses sound waves to look inside your neck. Requesting this ultrasound gives you and your doctor the opportunity to intercept arterial damage years before it results in a stroke or a heart attack. Step 3 requires connecting the mind to the body. We have to ask how the emotional memory of a disaster physically manifests as plaque in an artery 40 years later. Surviving a disaster involves intense, compounding stressors, bereavement, isolation, and the direct physical impact of the event itself. This chart maps the brain-heart pipeline. Psychological trauma, like PTSD, floods the body with stress hormones. Over time, these hormones trigger systemic inflammation, which damages the walls of your blood vessels and leads to plaque formation. Because women are more susceptible to post-disaster PTSD, add a PTSD and depression screening to your checklist. Addressing the psychological root breaks the first link in this biological chain. A mental health checkup is a cardiovascular treatment. By treating the trauma, you are actively protecting the physical integrity of your arteries. Step 4 moves into immediate, daily action. You need a lifestyle strategy to neutralize the inflammation identified in the study. Deep trauma can cause autonomic dysfunction, where the nervous system gets stuck in a chronic fight or flight state. This state continuously wears down your blood vessels. To reset your nervous system, you can implement one of 3 accessible methods: 15 minutes of daily breathwork, prioritizing 8 hours of sleep, or a nutrient-dense Mediterranean diet. Look at your checklist right now. Pick one of those 3 habits and commit to starting it tomorrow. We cannot erase the events of our past, but we do have daily control over how our body responds to those memories. You now have a completed, tailored 4-step action plan. The Tangshan study proved that severe stress from massive disasters leaves a physical imprint on our arteries, and that women carry the greatest risk. But now you have a defense. Map your risk, ask for a carotid ultrasound, screen for PTSD, and start an anti-inflammatory habit. Take a screenshot of this list for your next appointment, or share this video with a woman in your life who has survived a traumatic event. Past trauma does not have to dictate your future. By arming yourself with this data today, you take your power back.